Hi all, I am introducing before you through this video the syllabus of Rajiv Gandhi University of Allied Health Sciences and bsc.rdt course. Let's get into the video. All those who have taken Allied Health Science course in first year have the same syllabus. That means MLT, RDT, RCT and other courses are same subject and same topic in first year. In first year, we have 5 main subjects to study. First, basic anatomy. Second, physiology. Third, biochemistry. Fourth, pathology. Fifth, microbiology. Besides that, there is subsidiary subject. But all these subsidiary subjects are conducted by the college itself and the result is sent to the university. But the main 5-subject exam is conducted by the university. First year all exams are of 120 marks and 60 marks are required to pass in them. That is internal marks and 60 marks are required to be written. The first 2 questions are of 10 marks and are long essays. Then there are 10 questions of 5 marks and they are short essays. Next 10 questions are short answer for 3 marks. We are looking at the topic of basic anatomy. Along with this is histology. There are 11 topics in basic anatomy. 1. Introduction. 2. Connective tissue. 3. Ca diavascular system. 4. Gastrointestinal system. 5. Respiratory system. 6. Urinary system. 7. Reproductive system. 8. Endocrine glands. 9. Nervous system. 10. Sensory organs. 11. Embryology. Anatomy's question paper is for 100 marks. Next is physiology. It has 11 topics. 1. General physiology. 2. Blood. 3. Nerve muscle. 4. Respiratory system. 5. Cardiovascular system. 6. Renal system, skin and temperature. 7. Digestive system. 8. Endocrine system. 9. Reproductive system. 10. Central nervous system. 11. Special senses. Physiology question paper are in 100 marks. The next subject is biochemistry. It has 17 topics. 1. Carbohydrate chemistry. 2. Lipid chemistry. 3. Amino acid and protein chemistry. 4. Nucleotide and nucleic acid chemistry. 5. Enzymes. 6. Digestion and absorption. 7. Carbohydrate metabolism. 8. Lipid metabolism. 9. Amino acid and protein metabolism. 10. Vitamins. 11. Mineral metabolism. 12. Nutrition. 13. Renal function test. 14. Radioactive isotopes. 15. Clinical biochemistry. 16. Fundamental chemistry. 17. Solutions. Biochemistry question paper in 100 marks. The next subject is pathology. It has main 4 topics. 1. Clinical pathology. 2. Hematology. 3. Blood bank. 4. General pathology. There are 5 topics in general pathology. 1. Cell injury. 2. Inflammation. 3. Hemodynamic disorders. 4. Immune system. 5. Neoplasia. Exam in pathology is for 100 marks. The next subject is microbiology. It has 10 topics. 1. Introduction. 2. Growth and nutrition. 3. Sterilization and disinfection. 4. Biomedical waste management principle and practice. 5. Immunology. 6. Infection. 7. Systematic bacteriology. 8. Parasitology. 9. Virology. 10. Mycology. Microbiology exam is for 100 marks. If you ask me which subject is easiest in first year, I will say all subjects being tough. Next, we are going to look at the syllabus of second year BSc Renal Dialysis Technology. This year we have 5 papers, but there are 7 subjects to study. First, applied anatomy and physiology related to dialysis technology. Second, pharmacology related to hemodialysis and peritoneal dialysis. Third, concept of renal disease, clinical manifestation and its management. Fourth, applied aspect of pathology and microbiology. Fifth, basics of renal dialysis technology. Theory exam in anatomy and physiology related to dialysis technology 120 marks. Anatomy 50, physiology 50 and IA 20 marks for theory exam of 120 marks. Pharmacology related to hemodialysis and peritoneal dialysis is 120 marks theory exam in 100 marks and IA in 20 marks. Theory exam on paper 120 marks concept of renal disease, clinical manifestation and its management. There is no practical exam for all 3 papers mentioned above. Applied aspect of pathology and microbiology theory exam in 120 marks, that is microbiology 50 marks, pathology 50 mark for writing exam IA is 20 marks, total marks 120. Theory exam on basic of renal dialysis technology is also for 120 marks. There are 2 practical exams above this. 80 marks for practical exam and 20 marks for IA, so total marks are 100 marks. We are going to look at the topic of the paper, applied anatomy and physiology related to dialysis technology. There are 10 topics under applied anatomy and 10 topics under applied physiology, so total 20 topics are there in applied anatomy and physiology related to dialysis technology paper. Let's look at the topic of applied anatomy. 1. Basic anatomy of urinary system, structural anatomy of kidney, bladder, ureter, urethra, postulate. 2. Histology of kidney. 3. Blood supply of kidney. 4. Development of kidney in brief. 5. Anatomy of peritoneum. 6. Concept of abdominal hernia. 7. Anatomy of vascular system. 8. Upper limb vessel, course distribution, branches, origin and abnormality. 9. Neck vessel, origin and abnormality of course distribution, branches. 10. Femoral vessel, course distribution, branches, origin and abnormality. Next, let's look at the applied physiology topic. 1. Mechanism of urine formation. 2. Glomerular filtration rate. 3. Clearance studies. For physiological value, urea, creatinine, electrolytes, calcium, phosphorus, uric acid, magnesium. Luke's 24-hour urinary test, urea, creatinine, electrolyte, calcium, magnesium. 5. Physiology of renal circulation. 6. Factors contributing to and modifying renal circulation. 7. Autoregulation. 8. Hormone produced by kidney and physiologic alternation in pregnancy. 9. Hemostasis, coagulation cascade, coagulation factors, autoregulation, bleeding time, clotting time, prothrombin time, partial thromboplastin time, thrombin time. 10. Acid-base balance, basic principle and common abnormality like hypokalemia, hyponatremia, hyperkalemia, hypernatremia, hypocalcemia, hypercalcemia, pH. Next, paper 2, pharmacology related to hemodialysis and peritoneal dialysis. It has 15 topics. Let's look at each one. 1. Diuretics classification, action, dosage, side effects and contraindications. 2. Antihypertensive drugs, classification, action, dosage, side effects and contraindications. 3. Vasopressors and inotropes, classification, action, dosage, side effects and contraindications. 4. Colloids and crystalloids, classification, action, dosage, side effects and contraindications. 5. Erythropoietin, classification, action, dosage, side effects and contraindications. 6. Phosphate binders, calcium supplements, folic acid and other vitamin supplements used for patients on dialysis. 7. Iron supplementation injections and tablets, classification, action, dosage, side effects and contraindications. 8. Anticoagulant classification, action, dosage, side effects and contraindications. 9. Protamine sulfate, dose indication and side effects. 10. Antibiotics used in dialysis patients to treat catheter infections and peritonitis. 11. Vaccines used in dialysis patients, dose and frequency. 12. Peritoneal dialysis solutions composition and different types of fluids. 13. Immunosuppressive drugs. 14. Hemodialysis solutions, composition and dilution ratios. 15. Continuous renal replacement therapy, CRRT, solutions and citrate coagulation. Paper 3 is Concepts of Renal Diseases, Clinical Manifestations Evaluation and Management and has 14 topics. 1. Acute renal failure. 2. Nephrotic syndrome, primary and secondary. 3. Nephritic syndrome. 4. UTI, urinary tract infections. 5. Asymptomatic urinary abnormalities. 6. Chronic renal failure causes, stages, diagnosis and management. 7. Renal stone diseases. 8. Obstructive uropathies. 9. Congenital and inherited renal diseases. 10. Tumors of kidney. 11. Pregnancy-associated renal diseases. 12. Renal vascular disorders and hypertension-associated renal diseases. 13. Renal replacement therapies. 14. Renal nutrition, pre-dialysis stage, stage 1 to 4, hemodialysis, peritoneal dialysis and post-transplant. Applied aspects of pathology and microbiology, which is paper 4. There are 10 topics in pathology and 6 topics in microbiology, which means paper 4 has a total of 16 topics. First, let's look at the pathology topic. 1. Congenital abnormalities of the urinary system. 2. Classification of renal diseases. 3. Glomerular diseases, causes, types and pathology. 4. Tubule interstitial diseases. 5. Renal vascular disorders. 6. End-stage renal diseases, causes and pathology. 7. Pathology of kidney in hypertension, diabetes mellitus, pregnancy. 8. Pathology of peritoneum, peritonitis, bacterial, tubular and sclerosing peritonitis. Dialysis-induced changes. 9. Pathology of urinary tract infections. 10. Pyelonephritis and tuberculous pyelonephritis. Second, let's look at microbiology. 1. Hepatotrophic viruses in the detail. Mode of transfusion, universal precautions, vaccinations. 2. Human immune deficiency virus, HIV, mode of transfusion, universal precautions. 3. Opportunistic infections. 4. Microbiology of urinary tract infections. 5. Microbiology of vascular access infection, femoral, jugular and subclavian. 6. Sampling methods for culture and sensitivity. There is also a practical exam on the paper phone. The last paper is Basics of Renal Dialysis Technology. Paper 5 has 20 topics. 1. Checking vitals, blood pressure, heart rate, respiratory rate and temperature. 2. Basic science related to dialysis. 3. Indications for dialysis. 4. Types of dialysis. 5. Vascular access. 6. Dialyzer types, membrane, surface area, clearance and KUF. 7. Dialysis solution compositions. 8. Pre-hemodialysis assessments. 9. Monitoring during dialysis. 10. Post-dialysis assessments. 11. Complications during dialysis. 12. Hemodialysis machines preparation and settings. 13. Hemodialysis machine alarms during dialysis and troubleshooting. 14. Anticoagulation. 15. Dialyzer reuse. 16. Water treatment system basics. 17. Peritoneal dialysis, physiology of peritoneal dialysis and apparatus for peritoneal dialysis. 18. BCLS and crash cart management. 19. Equipment used in dialysis and its monitoring and safety check. Hemodialysis machine, dialyzer reprocessor, CRRT machines, cardiac monitors, defibrillator, ECG machines, BP apparatus, USG machines, acid bicarbonate mixing system, water treatment system. 20. Infection control practices and universal precautions. Hand wash, waste management, needle stick management and prevention, personal protective equipment and appropriate usage, cleaning and disinfection of dialysis machines, managing patients with HIV, HBsAg and HCV, vascular access, infection prevention, blood spill management, hazardous material storage and spill management. Paper 5 also has a practical exam. Paper 5 and Paper 3 were easy for me in second year. Paper 1 and 4 been little bit tough. Paper 2 was a bit more work. This is my point of view. This can be or not happen to everyone. Now I am going to talk about the third year. RDT has only 2 papers per year. One is Applied Dialysis Technology Paper 1. 2 Applied Dialysis Technology Paper 2. Both these theory exams are of 120 marks. 100 marks in written exam and IA marks in 20. Practical exam is out of 200 IA 80 per paper. IA marks are 20 marks per paper. The total third year exam is of 440 marks. Going to look at the topic of paper 1. 1. Chronic renal failure and acute renal failure causes, stages and management. Indications for dialysis. 2. Choice of renal replacement therapy, RRT modality. 3. History and types of dialysis. 4. Theory of hemodialysis, diffusion, osmosis, ultrafiltration and solvent drag. 5. Vascular access for hemodialysis. 6. Hemodialysis apparatus. 7. Acute hemodialysis prescriptions and chronic hemodialysis prescriptions. 8. Complications during hemodialysis. 9. Biochemical investigations for dialysis patients and its significance. 10. Urea kinetic modeling. 11. Anticoagulation. 12. Dialyzer reuse. 13. Withdrawal of dialysis criteria. 14. Physiology of peritoneal dialysis. 15. Apparatus for peritoneal dialysis. 16. Peritoneal dialysis catheter, placement and care. 17. Peritoneal dialysis for the treatment of acute kidney injury. 18. Adequacy of peritoneal dialysis and chronic PD prescription. 19. Volume status and fluid overload in peritoneal dialysis. 20. Peritonitis and exit site infection. 21. Hernia, leaks and encapsulating peritoneal sclerosis in peritoneal dialysis, mechanical complications. 22. Metabolic, acid-base and electrolyte aspects of peritoneal dialysis, metabolic complications. The topic of paper 2 will be looked at next. 1. Dialysis in infants and children. 2. Extracorporeal treatment for poison and drug overdose. 3. Online hemodiafiltration HDF. 4. Continuous renal replacement therapy CRT. 5. Molecular adsorbent recirculating system MARS. 6. Home hemodialysis and intensive, frequent. 7. Sorbate dialysis technology. 8. Plasmapheresis. 9. Dialysis in special situations. 10. Telemedicine in dialysis practice. 11. Water treatment system. 12. Diet in a patient with renal insufficiency and dialysis. 13. Basic cardiac life support. 14. Special problems in dialysis patients. 15. Medication administration and IV therapy. 16. Quality in dialysis. 17. Preparing dialysis patients for transplantation. 18. Renal transplantation principles, immunology, patient selection, surgical procedure and complications. In third year, I felt the two papers were the same. I had a feeling of okay. Thank you for watching this video. Share it with anyone.